Go ahead.
Welcome to our media advisory this afternoon, the day after Easter. Hopefully you've had a way of finding some joy and passion in Easter and Passover over the weekend. We will remind you that the group gatherings, as per the provincial order, is still anything less than 5 people. Please continue to adhere to those physical distancing requirements. The city's new physical distancing bylaw prohibits certain activities and regulates physical distancing during COVID-19 emergency. So bylaw officers will be educating on the importance of physical distancing, but also can fine individuals $500 for not abiding by the recommendations of our health officials. The city continues to work with our federal and provincial partners daily, and just this past few days, the province launched a $50 million Ontario Together Fund to help businesses provide innovative solutions and retool their operations to manufacture essential medical supplies and equipment, including gowns, coveralls, masks, face shields, testing equipment, and ventilators. And many local companies in Hamilton have retooled their operations to help with this crisis. The province also extended its order to at least April 23rd, 2020, and I expect that they'll extend that even further as a state of emergency for another 28 days thereafter. The federal government sat for an emergency session on Saturday, passed the government's revised legislation Bill C-14, which is an act to allow for certain measures in response to COVID-19, which is the emergency wage subsidy, $73 billion going to be sent out to provide wages for businesses that have lost income amid the COVID-19 pandemic. Federal health officials also released a new interim infection prevention and control guidance for long-term care homes nationwide. I'll leave it to Paul and Dr. Richardson to share more information about that. And more information is on the city's website, as always, outlining the various financial supports available to help individuals and families experiencing challenges due to COVID-19. So visit hamilton.ca/coronavirus/financial support individuals. All the information you need to access some of the financing and funds that the federal and provincial governments have been putting forward are available to you there, and applications you can apply through there as well. Just as a reminder, in the upcoming days, we'll be announcing that local social service providers and community organizations will be able to apply to receive emergency funding for COVID-19 services, whether it's for frontline service delivery to support those who are infected, or to increase prevention efforts to keep people safe. The city is committed to supporting community organizations during this critical time. Watch the city's website and social media channels for more information on all of that and how that funding can be accessed. And again, a reminder that city facilities remain closed. The target date is still May 25th. The public can still do business online, and all of your counselors and administrative staff are still available at their usual emails and phone numbers. And we ask you to continue to adhere to the closure of the stairs, the waterfalls, the parking lots, beaches, play structures, all of them closed to protect your health and safety at this point. So I'm going to turn it over to our Emergency Operations Director, Paul Johnson, for additional updates around transit and other matters. Paul?
Thanks very much, Mr. Mayor. And today, not a lot of new announcements, but I do want to thank some people for the work that's happening in our community. I want to thank our own staff in housing services, but in particular, our shelter providers, folks like the Good Shepherd Centers, who are helping us to operate a new shelter, which has taken a bit of pressure off the existing men's shelter system. It is a First Ontario Center, and I can say as of today, 30 individuals are now there. We opened it over the weekend with 15. It's now up to 30 and can accommodate up to 50 people. So thank you for those who led to a smooth opening of that on Saturday evening. Thanks to our paramedics. Our city paramedics are, of course, responding to all the calls that they normally will, taking extra precautions on COVID calls, but also have started to work alongside public health and our primary care and hospital partners to increase testing. And I know Dr. Richardson will be talking a little bit about testing as well, but I just want to thank our paramedics for stepping up and helping to do a bit of the mass testing that we're going to be doing in some of our congregate facilities, such as retirement homes. As the mayor mentioned, thanks to our Housing Services Division and our EOC Operations Chief, who will work hand in hand to get some of the social service funding out the door very quickly. Their goal is a turnaround of about 7 business days from application input through to approval and money starting to flow. And that means that a daily conversation will take place about the applications, and we'll try and make those approvals as quick as possible. And I think that that's great, because we know that the services on the ground need to get going fast. They need that financial support. Lots of education is being done by both bylaw and the police, and I thank them for the education around it. We are handing out a few tickets here and there, but generally speaking, a lot of people getting good information and education about what we're doing from an enforcement perspective, and relatively low numbers of tickets being handed out, and that's probably the way we want it. And just in terms of that, a lot of people are adhering to the closures now. Things like our stairs, we actually have counters on our stairs, so we can actually tell whether people are sneaking around the signs and in a clandestine way using stairs, for instance, and we are down to next to 0. Well, before we put those signs up, in the case of the Shadoke stairs, there were 4,000 trips a day happening. So thank you to those who are adhering to the signs, the closures in parks and things along those lines. And there are, a few hot spots that we go to. Albion Falls continues to be a problem. It is closed, and I know how beautiful it is. I know how wonderful it is. Please do not go there. It is closed to the public, and will be until we open up our amenities that way. So stay away from those areas, but people are really doing the right thing. And as I was out personally on the weekend, I'll end on this note. I walked around my neighborhood on the sidewalks in my neighborhood, and saw lots of great messages of chalk art around my neighborhood from local children in the neighborhood saying, stay safe, we'll get through this together, those types of messages. I even saw some kids who had put down tape at 6 feet, demonstrating to people even on the sidewalks what 6 feet meant and 2 meters meant. So they were probably 2 meters, because they understand just meters and centimeters. I still think in the feet. So I think a lot of good things happening to try and reinforce physical distancing. And that's really important, because things like our public transit, we really need people to recognize the importance of that physical distancing. People are doing a great job. Our transit operators appreciate it. And I think for everybody's safety, we appreciate people recognizing that distancing is important for services like transit, for going to places like grocery stores and others where naturally there will be people, lots of people in an area. We just need to do our job in sort of keeping that going. So from a city service perspective, we've sort of settled into where we are right now in terms of service delivery, and very pleased to see a few of the extra things we got going over the weekend in terms of working with vulnerable populations to be happening in quite a smooth fashion. So, Dr. Richardson.
Thanks, Paul. So we're going to go over the case update as per usual to start us off. So we're at 256 confirmed cases in Hamilton as of noon today. There are, of course, more details on our website about the status of cases, all their demographic information, that sort of thing. Just again, want to focus a little bit on the number who have resolved. So of the 256 cases at this point, 114 are resolved. So that's about 45% of the cases. So good news in terms of people are moving through this and have come out the other side and feeling better. We do now have a total of 9 deaths. There were 2 new deaths that were reported over the weekend. And 1 new death that was reported today. So the 2 over the weekend were from the Cardinal, a 71-year-old male and an 88-year-old male. And then the new death that was reported just today is a 94-year-old female as well from the Cardinal retirement residence. We do have 7 institutional outbreaks now at this point. So the one that we're all familiar with at Heritage Green Nursing Home, where they continue to have 11 residents who are confirmed as COVID positive and 3 staff members. At the Cardinal, there's now 22 confirmed resident cases and 13 confirmed staff cases. Just one thing to note is that with some of these homes, the staff, when we're reporting on staff numbers, we're talking about people who are working in the institution. They may not be employed by that institution. They may be employed by a service providing agency that brings services into that institution, but we count them all amongst the staff group. At Wentworth Lodge, we also have an outbreak with a single confirmed staff member there, remembering just that one case in either a staff member or a resident makes an outbreak. At St. Joe's and the special care nursery, they have the 3 confirmed healthcare workers, no change on that front. The new outbreaks that were reported were Chartwell Deerview Crossing retirement residence with a single lab confirmed staff member, Kingsbury retirement residence where they too have 2 lab confirmed residents, and Clarion Nursing Home who has a single lab confirmed staff member. So that's the situation in terms of where we are with the outbreaks. Testing criteria have changed. So as you heard from Premier Ford last week, they're looking to increase the number of tests that are available to be done. And we have been looking at how we can get more people through that testing in all of our sites. So now the testing includes symptomatic people from higher risk populations. That includes symptomatic healthcare workers, first responders, children attending essential daycares, and others. That full list is available on our website. The process, though, for determining who should be tested remains the same. So if you're ill and need to be seen by somebody very urgently, then you should go to one of the urgent cares or to the hospital emerge department, and they'll make a decision about testing. If you're at home and you're feeling mild to moderately unwell, give us a call on the public health hotline, and we can book you in for testing at one of the assessment centers, or call your family doctor and they will book you into assessment at one of the assessment centers. They are up and running and equipped with sufficient supplies to test more people for the virus. We are also planning additional ways that we can do testing, and so stay tuned for that a little later this week. On the PPE front, as we like to call it, we like our short forms in public health, or personal protective equipment. The federal, provincial, and local efforts to procure and distribute PPE materials continue to be a priority. We're aware that there's some movement being made on that front provincially, and as well the federal government is looking to bring in more as well. I think one of the message I want to wrap up with is really about mental health and well-being. And what we are asking people to do is not easy. Overall, the response and compliance from the community so far has been very encouraging. People are doing as they're asked to do. There may still be the occasional person who Paul would tell to knock it off, but by and large, people are doing as they're asked. And I want to underscore that the difficult measures that each of you are taking collectively to do this is having an impact on our numbers. While they continue to climb, we aren't seeing a surge in cases that might have happened if we weren't doing these measures. So it's very important to stay the course a while longer, continue that physical distancing, to stay home, except to go out for groceries, food, and medicine. It does take a toll on our mental health and well-being to be apart from our coworkers, from other friends and others, and the alteration in our daily routine definitely has an impact on our lives. We need to make sure we're accepting that the stress and the anxiety that might come of this are very normal feelings. And if you're feeling that it's more than something you can cope with, definitely reach out for help. So keeping in touch just on an everyday basis with your family and friends, virtually via video chats, email, and phone are really important. Remember too to take care of yourself. Practicing self-care is important all the time, and no time more so than right now. So going out for a walk or a bike, and it's been very encouraging when I'm on the way to the grocery store or whatnot to just see how many people are out there walking and cycling. And hopefully these are habits that you're building that are actually going to last well beyond this event. Yoga is a great thing too. Mindfulness and breathing practices are really good. And as well, of course, making sure you're getting enough rest. And on that note, making sure to unplug. So while you may be dialed into social media or online to catch some things up, or be the kids catching up with their schoolwork when they're back at school tomorrow, remember to take breaks from the media, from social media, and from the internet. It's really important to try and find balance. Back to you, Mr. Mayor.
Great advice, Doctor. Thank you very much. And just on that, then, if people are in crisis or mental health crisis, they can call COAST at 905-972-8338. And the Kids Help phone line is at 1-800-668-6868 for any kids that are in stress or in crisis. They can kind of get a hold of that number, or they can text 686868. Very important that you reach out if you're having mental health challenges or domestic challenges of any sort. Doctor mentioned the work being done on personal protective equipment And that work is ongoing, and we're still asking for any donations that the community can make in terms of N95 masks or impervious gowns, gloves, face shields, swabs, and sanitizers. All of that is welcome at ppe@hamilton.ca. We will arrange to pick it up, or you could call at 905-546-2424 at extension 2257. I'm sure you're going to memorize all these numbers, but important that you get a hold of us and let us know that you have some available that we can share. Cargo jet that is predominantly housed here in Hamilton at the John C. Munro Airport is bringing in some 75,000 pounds of personal protective equipment to personnel on the front line in Ontario. So they're bringing it in from Shanghai, China, and that's a very positive step, and we expect more to come along. And we thank Betty Smith, who brought joy to children and adults alike this past weekend by dressing up as the Easter Bunny outside her store on King Street East and Gibson Avenue. And Betty danced and sang and handed out Easter chocolates and candy, obviously all at a safe distance. Just a little measure to bring some joy into the broader community, and certainly that's a very important issue for all of us to think about: is how do we bring joy to these difficult times? To one another and to our family and friends at a distance. So my daughter and potential future son-in-law delivered a nice Easter meal for us at a safe distance in the driveway. It always tastes so much better when somebody else makes it. And those kinds of little touches of personal camaraderie and family connection are so important at this point in time. Do that with your family and friends. It's critically important, and I'm sure always appreciated. I want to thank again our American Sign Language interpreters, Rosalie Visers, who I can't see doing their 30-minute workout right now, Georgia Whalen, but I'm sure are providing the translation for the deaf, and we thank them for their ongoing work to make sure that we can share the information with all of our citizens. And a reminder that every Wednesday and Sunday at 6 p.m. for those that are in the church community, if you could ring your bells in support of all the frontline healthcare workers at 6 p.m. Wednesdays and Saturdays, just to support our first responders and everyone keeping our city cared for, safe, and fed during this pandemic. Hopefully, and I've heard the churches on Sunday and on Wednesday, and it's really quite a nice show of appreciation. And of course, the first responders drive-by past all of our local hospitals was another great demonstration of appreciation for the very, very hard work our public health and frontline hospital workers are doing to look after us each and every day. So we thank all of them for their great effort, and thank you for continuing on with this important work. This is, again, as the doctor said, never easy. We're all challenged by this. Some of us more so than others, and the more that we can help one another, the better off we're going to be. And the more we can keep doing this, the shorter the period of time will be that we have to continue to do this. So even though it might be longer than we might all anticipate, the fact that we're still doing it and will continue on for some time yet is going to make a difference in terms of us having an impact on the numbers. And of course, condolences go out to the family members that have lost family members and those that are struggling with the disease right now. We know you're in good hands in our public health system, but these are difficult times for people that are challenged in terms of their lives being at risk at the moment. On that note, I'm going to turn it back over to Jasmine for any media questions.
Thank you, Mr. Mayor. We did have a number of media partners join us today. The first question will be to Bobby from CBC. Let's just make sure Bobby's unmuted there. Yes, Bobby, go ahead.
Thank you very much. I hope, can everyone hear me okay?
Yep, we can hear you.
Okay, fantastic. I hope everyone's had a good long weekend, staying safe. I've got a question, I guess, for Dr. Richardson. How are we still seeing cases pop up in nursing homes, despite all the restrictions in place about getting into nursing homes, having no visitors? Why is this continuing to be a problem?
So, Bobby, that's something that we're all watching and monitoring very closely in terms of that, and why there's been some changes in the last week or so. So we know that, as you said, we have very much put a ring around these institutions in order to protect people, but people do still come and go from those in terms of the staff who are there or essential visitors who are coming in to see very sick relatives or people who are unfortunately on palliative care at times. So there is some movement in and out in terms of people. And of course, we do know there's community spread that is occurring out there that any of those people could have contact with while they are outside of the institution. That is, the staff people do. And so last week you saw a move to recommending universal masking of people who are in long-term care homes and in retirement homes. That is the staff. In order to prevent any spread before people become symptomatic. So we know probably about 48 hours before people become symptomatic with COVID-19 that they can spread the virus. And so wearing a mask as a preventive measure is really important in order to try and stop that spread. So that was another further measure that was put in place in order to try and reduce that from happening.
Thank you. And I guess in terms of, as Paul, maybe this is a question for Paul, I'm not really sure, but in terms of seeing people get out and you said Albion Falls continues to be a problem. Are there other areas that you're also looking at with, I guess, some concern?
They pop up here and there. I do know that there was a fair bit of education that was being done in Gage Park over the weekend. We had some nicer weather at times over the weekend. It was warm and for parts of it sunny, warm and sunny. So people got out. So I think large parks are still a draw, and that's wonderful in one sense, walking through a large park. I've got a decent sized park right by me at Valley Park, and so there's lots of space around it. So there were still some people choosing to sort of gather and sit together or whatever. So I think we continue to work on that. But when I talk to our licensing and bylaw folks, they are very, very pleased. For a city of 540,000 people with all the great spaces we have and all the great businesses and other things that are going on, the hot spots are few and far between, and I think people are getting the message, and that allows us to get out and continue to reinforce that message. So people need to keep it up. The other thing that's happening, and this is driving it, is of course the public have been encouraged to report this. So they are able to report. So before, when it might have been us having to try and get out and find these things, when things are starting to bubble up, the public are more than willing to phone in and let us know. And I would encourage them to continue to do that when it's warranted. When you see, numbers of people gathering and it just doesn't look right and it's too many people, let us know, because that's the way we can send our resources out. We can't cover the whole city all the time, but we can definitely get to where it needs to go. But Albion Falls continues to be a challenge for us. It has been from the very early stages of this before we fully closed it, and it continues to be a challenge for us. So I think I wanted to put a specific mention in again about Albion Falls. It is closed, and please stay away because all the parking lots are closed as well. And so, there's no parking anywhere around it anyways. So let's just stay away from there.
Thanks, Paul. Our next question goes to Matt Ingram from CHCH. Matt, we'll just make sure you're unmuted there, and then you can go ahead.
Thanks so much for taking my question. I'm wondering, Doctor, if you could just talk a little bit, today Dr. Teresa Tam was talking about the urgency of taking care of people in long-term care centers. I was just wondering if you could talk a little bit about how the city is overseeing the implementation of some of these new directives at these facilities to keep people safe.
Thanks very much for that. When it comes to these new directives, they've been focused on a few things like universal masking, as I mentioned, also increasing testing when we're seeing outbreaks. And so we're working with those outbreak facilities to look at increasing testing. We did that in the Cardinal just this weekend, and are going to look at doing it with others to try and understand what is the pattern, how much has happened in terms of spread, and so we can understand how testing plays a role in that. So we're working alongside them. I would say it's not so much a role of overseeing them as working with them to ensure that they are understanding the directives, they're able to put things in place. We're helping to problem solve with them if they're having challenges in doing that, directing them to the people who can help them to do those things. If there are challenges, or if there's ever a time where we're having a compliance issue, there are tools available to us. We can turn to regulators. We can use some tools that we have at our disposal. But by and large, this is a very cooperative, collaborative effort. These are people who care deeply about the people who are in their care, and they very much want to do the right thing. And so by and large, it's getting out of their way and giving them the tools so that they can provide that care.
And my follow-up to that would be, no doubt they're caring people and they're doing the best we can, but we are hearing horror stories out of Quebec and other isolated incidents. Can you talk to me? Have there been any compliance issues or any cases where you've had to step in and say, no, you're not doing this correctly. We need you to follow such a directive?
So there's certainly been cases where we're talking things through. As I said, it's largely a collaborative approach where we're talking through issues and helping them to resolve things. These, as I said, the operators want to do their best. It is a challenging, very challenging time for some of them. And so, collectively as a community, sometimes we need to wrap around and ask for PPE and share PPE. You've heard Paul talk about the Cardinal in previous days on the media, where we're talking about what do they need? How can we share? How can people come in to help support any given institution? But as I said, there's not sort of somewhere in particular at this point where I'd say we really had any major challenges that weren't the real issues in terms of retirement homes and places that normally don't do high levels of care now having to deal with a very different situation where they're having to wear PPE all the time and those sorts of things. So we're helping them to problem solve through those issues and to help them get staffing.
Thank you. Next question will go to Joanna from the Hamilton Spectator. Joanna, go ahead.
Hi, thanks so much for taking my question. I'm looking to find out if you can give me an update on where the city is with its PPE, how your shortage is right now.
So we continue to hold steady in terms of PPE. We have no places where we're making emergency requests of the province, for instance, where we would be down to 2 or 3 days. So we continue to hold our own. There are certain areas where we have less materials. That has to do with face shields and gowns. Typically, are where we're always trying to keep ahead of that. So if there are 2 areas in terms of some of the work that we're doing, it would be in there. But we're optimistic that the provincial and federal governments are coming through with the supplies. We've heard about them. We're on calls this morning that are saying they're being delivered to kind of provincial hubs, which will then get delivered to the community. I will say the one thing that continues to put a pressure on it is these new directives that come out that change the burn rate for PPE. So we are today reevaluating the timing that it will take in terms of when we'll get into critical shortages, because there are changes in long-term care. And the other piece is we really are wanting to support our vulnerable sector around homelessness, and not all of those agencies have the same access to PPE. So short answer is I haven't raised any alarm bells with our provincial emergency operations centers that the ministry is operating. We continue to be stable, but it's a nervousness factor for me every day, because I would like to have a lot more in stock than we do. And that doesn't make me any different, though, than any other municipal EOC director, nor anybody else in healthcare. So right now, stable, but very much looking forward to seeing some of those new supplies come our way.
Great, thank you. And my second question is to Dr. Richardson. Does public health have any thoughts or guidelines when it comes to reuse or extended use, particularly reuse of personal protective equipment?
Thanks, Joanna. That's a really important issue. That's being worked on at the federal level, the provincial level. Everybody is working on this one because of the short supply that is available, particularly around N95 masks and surgical masks. So there has been a lot of scientific review happening, where, as I said, at both levels, but particularly the provincial level, to determine which are the best methods for reprocessing. And some people have started to do that now. So they're actively gathering the N95 and surgical masks and some other PPE to see if they can be reused. The shields that are used can by and large be cleaned properly with disinfectants and reused. So that's good news. Those don't even need to go into a reprocessing sort of process. But we're not giving specific guidance on that because we know there's many other people looking into that issue and giving guidance on it. We're just encouraging people right at this point to make sure they're following the conservation guidelines that have been put out, and to make sure that they are saving those masks and both N95 and surgical masks, as well as reusing the goggles and shields, so that it'll enhance our supply.
Thank you. And with that, that's the end of our media questions. Mr. Mayor, I'll pass it back to you for closing remarks.
Thank you, and thank you all for staying tuned with the questions on what's happening in our community. Very important that we keep the community at large up to date, and we'll continue to communicate. As you know, that Wednesday night we'll be doing our town hall as well at 7 p.m. to further answer any community questions that are out there relative to this issue. A reminder again to please be patient with all of our workers out there that are keeping our city functional. I'm thinking about our bus drivers, the grocery store clerks, the pharmacy clerks, the police, the fire, the paramedics, even the public works and garbage collection, all of them out there every day, keeping our city functional. And be patient, be kind, be courteous, and be grateful for their effort as they're stepping out every day, probably more than we are. While we're self-isolating, they're out there working to keep our city functional. So be kind to them, be patient with them, and show some appreciation whenever you can. And Hamilton, keep doing what you're doing. As the doctor said earlier, and Paul, my bike around my neighborhood, over the weekend really was everybody's doing what they're supposed to be doing, keeping their distance, still staying socially connected, either through digital platforms or at safe distance. People can stand at the ends of their driveways or go for a walk in their neighborhood or their local park. Very important that you get out, because you can go a little stir crazy being inside all the time, and especially if the rain comes, you want to take those opportunities when the rain isn't happening. But in the meantime, thank you community, thank you citizens. You're doing everything we're asking you to do, and we appreciate it. It's all for the right reasons, to stop people from getting sick and for saving lives. So thank you, and we'll see you Wednesday at our town hall.